Hello everyone, welcome back to my YouTube channel, and today we are going to talk about palatine bone. And there you can see the diagram. The orange color part of the bone, or the orange bone in here, is the palatine bone. So let's start our topic with introduction. Palatine bones are paired bones. That means there will be two palatine bones in every skull, and they are L-shaped bones located at the back of the nasal cavity. They contribute to the formation of hard palate, nasal cavity, and orbit, and playing a crucial role in facial structure and function. Let's talk about the anatomy of palatine bone. Palatine bone consists of two main plates and several processes. These plates are horizontal plate and perpendicular plate, and it also has several processes. Now we will talk about them one by one. First we will talk about horizontal plate of palatine bone. Horizontal plate of palatine bone forms the posterior part of the hard palate. It articulates with the maxilla to complete the roof of the oral cavity, and it contains the greater palatine foramina that allow the passage of nerve and vessel, and it also contains the lesser palatine foramina that also allow the passage of nerve and vessel. The next part of or process of palatine bone is palatine process. It extends vertically and contributes to the nasal cavity and orbit. It articulates with the sphenoid bone, ethmoid bone, and maxilla. It features the sphenopalatine notch, which forms the sphenopalatine foramen when joined with sphenoid bone. Now let's talk about the processes of palatine bone. They are pyramidal processes that project posteriorly and provides attachment for muscles. And it has orbital process that contributes to the floor of the orbit, and also has sphenoidal process that articulates with the sphenoid bone. Let's talk about the functions of palatine bone. The first function, it is the structural support. It forms part of the hard palate, nasal cavity, and orbit. The second function is passage for neurovascular system, as it contains foramina for nerves and blood vessels, and also function as a muscle attachment, as it provides encourage for muscle involved swelling and speech. Now let's talk about the clinical significance. First clinical significance is cleft palate. That is developmental defect in the palatine bone and can lead to the cleft palate, affecting speech and feeding of the child. The second clinical significance is sinus infection. The palatine bone contributes to nasal cavity, making them relevant in sinus-related condition. The next significance is fracture, as trauma to palatine bone can impact nasal and oral function. Now let's talk about the conclusion of the whole video. The palatine bones are essential for facial structure, function, and overall health. They are helpful in understanding the anatomy and clinical relevance, and crucial for medical studies and healthcare applications. So this was all about the palatine bone. Hopefully you liked the video. If you